Assalamu alaikum. Welcome, grade 2 medical student. Today we are going to talk about demography. By the end of the lecture, you should be able to define demography and enumerate its role in public health administration, list sources of demographic data, recognize measures of population projection, explain the different stages of demographic transition, and recognize population pyramid. Demography is a science concerned with the study of human population, especially with reference to population census, size, distribution, composition, and dynamic changes. يبقى الديموغرافي هو علم بيختص بدراسة السكان من حيث كل الخصائص بتاعتهم. population census يعني التعداد السكاني، السايز عددهم حجمهم قد ايه، distribution الكومبوزيشن والديناميك تشينجز يعني كل السوشيو ايكونوميك كاركترستكس بتاعتهم، الايج، السكس، الاديوكيشن، المورتاليتي، الفاميلي بلاننج، البوبوليشن بروبلمز، كل الديناميك تشينجز دي بدرسها في الديموغرافي. What is the importance of studying demography for public health administrators? Public health is the science of protecting and improving the health of people and their communities. So, studying of demography and population data are essential to defining and measuring the public health problems and the group of people in which they occur. Demography allows the study of the relationship between health and population dynamics to guide the need for changes in public health practice. This can be illustrated by certain important issues we learn from demography, such as aging of the population. Aging of population means when death rate declines in most parts of the world, the life expectancy increases and the median age of population increase. This results in a change in the spectrum of health problems of this group of people who are called geriatric population. So the health problem will change and the healthcare needs will become different. Teenage pregnancy and refugee are among the important demographic problems that may affect the public health. Teenage pregnancy may create preventable health problems for the infant and for the mother, affect the health of the whole community, socio-economic development, the health of the future generation. Also, refugee may bring with them serious public health problems such as severe malnutrition and infection. The role of public health practitioner is to carry out certain important tasks. The first is to identify the useful sources of information about population to calculate the vital statistics. Vital statistics means الإحصاءات الحيوية، هي مجموعة من الميجرز أو الستاتستكس هتاخدوها بعد كده بالتفصيل، بتشمل الموربيديتي والمورتاليتي ريتس. بنحسبها الموربيديتي يعني معدل حدوث الأمراض، mortality rates يعني معدلات الوفيات. طبعا مهم جدا ان احنا نحسب الفيتال statistics دي عشان to measure the burden of disease in the community, to know the historical pattern of the disease of the community, to know the geographic differences. ليها يعني فوائد كتيرة جدا ان احنا نحسب الفيتال statistics دي وهنتكلم عليها بعد كده بالتفصيل. تاني حاجة calculate the basic measures of population change. ايه measures of population change او population growth؟ ايه الحاجات الفاكتورز affecting change in community او change of population؟ حاجات زي fertility، mortality، migration. كل ده لازم احسب المعدلات اللي بتحصل في الكوميونتي للحاجات دي، وايه هي determinant of population change والcritical issues اللي ممكن تأثر والبروبلمز اللي ممكن تأثر على population growth. Sources of demographic data include the census, regular national survey and research work, and vital statistics. أول حاجة نتكلم عليها السنسس أو التعداد السكاني. التعداد السكاني بيحصل فيه enumeration of all population which reside in a precisely defined area in a certain country and in a well-defined time period. التايم بتاع السنسس أنا بختاره when the greatest most of the population are most likely to be in their own home. بختار وقت يكون معظم السكان موجودين في بيتهم. We should avoid the time of summer vacation agricultural seasons festivals. ببعد عن الأوقات اللي بيبقى فيها مواسم اللي الناس مفروض يعني بتخرج مش بتبقى موجودة في البيوت. في مصر هنا بيتعمل السنسس في شهر إبريل أو شهر سبتمبر. طيب مش بس بعمل enumeration، لا ده أنا بعمل collection of demographic and socio-economic data of the population. بجمع بيانات عن السكان، عن كل حاجة خاصة بالسكان، الage، السكس، الريليجن، education، occupation، الانكم، الفاميلي composition. فبجمع عنهم بيانات كاملة عن معظم السكان اللي موجودين. عملية الانيومريشن أو السنسس دي بتتكرر كل 10 سنين. طيب هل أنا أقدر أعرف عدد السكان في المدة دي، في بين ال10 سنين دي؟ في طريقة بقدر أعملها، إن أنا أحسب حاجة اسمها natural increase. بعمل إن أنا أحسب الديفرنس بين الكرود بيرث ريت ناقص الكرود ديث ريت. يعني بشوف البيرث ريت اللي عندي في السنة دي. لو أنا مثلا عملت التعداد السكاني بتاعي في سنة 2006، عايزة أعرف طيب عدد السكان سنة 2008 كان كام. فبحسب الريت اوف ناتشورال انكريز في السنين الفرق دي. بشوف عدد المواليد ناقص عدد الوفيات، وبعد كده بجمعه على اللاست سينسس، فبيطلع لي الانترسنسال estimation of population. عندنا السنترال ايجنسي فور public mobilization and statistics اللي هو الكامبس. It is the official statistical agency in Egypt that collects and analyze and disseminate statistical data and conduct population census. Population-based survey differ from a census. It is not a enumeration of all individuals and don't include all the members of population. Survey study is defined as a field study carried out for investigation of a certain disease or health problem, and usually include a confined group or closed community such as a school, a factory, a hospital, or a certain village. And sometimes it may include all the country and be a national survey. So the topic of the survey may collect information about health, the fertility, the use of health services, and the information can be used for demographic measures. Vital data is considered a good source of demographic data, especially births and deaths. Provide important data for dividing public health problems at almost every level of society, including cities, countries, nations, and the whole world. Population projection give a picture about the future size and the structure of population by age and sex. It's based on assumptions made for three components: fertility, mortality, and migration. So, based upon the past trends in the fertility rates, mortality rates, and migration, we can expect the population growth in the future. طب what's the importance of population projection? It's useful for planning to assess the need for new jobs, schools, housing, food needs, and also to help the policymakers to understand the health problems in the community and to develop solutions to these problems. Demographic transition and epidemiologic transition. Demographic transition means that a change in the age structure of population. As mortality declined, age structure of population changes to become mostly of aged population or geriatric population who are exposed to risk factors for longer period of time. This results in epidemiologic transition. Epidemiologic transition means a change in the pattern of health and diseases in the community. This pattern is changed from communicable disease to non-communicable disease. معنى الكلام ده ايه؟ معنى ان حصل تغيير في demographic structure of the population in most of the community it changed to become of aged population. So disease pattern it changed towards non-communicable disease. بدل ما كنا بنسمع عن إن معظم الوفيات نتيجة الانفكشنز diarrheal diseases الجاسترونترايتس الميسلز، لا دلوقتي بقت أهم الأسباب بتاعة الوفيات في معظم المجتمعات أو في الكوميونتي بقيت نتيجة الكارديوفاسكولار ديزيز الكانسر الهايبرتنشن الدايابيتس وكلها non-communicable diseases. Demographic transition model is a model that shows population change over time based on the socio-economic development. It illustrates the stages that the population of the countries go through when transitioning from non-industrial to industrial, and it has four stages. Stages of demographic transition as illustrated on this figure are four or five. Stage 1 is called a pre-industrial or high stationary. It's characterized by high birth rate, high death rate, and low rate of natural increase. The birth rate is high due to high infant mortality rate and lack of family planning. Children was considered as economic asset, so um, there was a high birth rate. The high death rate was due to diseases, lack of clean water, lack of health care, lack of food, and there was also low rate of natural increase, so the population growth was very slow. So this stage is called high stationary stage. Stage 2 is a transitional stage. Most developing countries in this stage is characterized by high birth rate and the death rate begin to drop rapidly due to improvement in the food supply, health care and sanitation. So the rate of natural increase begin to be high and there is a rapid population growth. Stage 3 is called industrial stage or expanding stage. It's characterized by low birth rates due to access to contraception and urbanization, education of the woman, and also characterized by uh, falling this rate. So the rate of natural increase began to decrease and there was a slower population growth. Stage 4 is a post-industrial stage characterized by low birth rate and the death rate remain low, so there is low natural increase. The total population are high but no longer growing rapidly. Stage 5 Stage 5 in certain countries characterized by low birth rate which drop below the replacement level which is 2 children per family and the death rate remains low, so there is a negative natural increase. The low birth rate drop below the death rate, so when we calculate the natural increase it will be negative, so this stage is called declining stage. Certain countries in this stage such as Germany. Population pyramid is a structure of population by age and sex distribution and constitute a number of strata. It depends mainly on the health of the nation and its social and economic standards. لو بصينا للفيجر هنلاقي ان الهوريزونتال level بيبقى عليه ال number of population million and vertical constitute the age strata and it is divided into two halves, half for the males and half for the females. Types of population pyramids. The first type is expansive population pyramid. The age structure of population differ according to the social and economic development of the community, the health status of the nation, population of the community at which demographic transition stage. So there are different types of the population structure and population pyramid. The first type is expansive population pyramid. If we look at the figure, we recognize that it has a broad base. The broad base means there is a larger number of population in the small age group from 0 to 5 and from 5 to 10 and from 10 to 15 age strata. So the broad base means that there is a high birth rate. Also, we noticed that it becomes narrow as it gets higher and rapidly taper, and this is mean there is a high age-specific mortality rate. So there is a high birth rate and there is a high death rate. The pyramid is narrow, has a narrow top. The pyramid is short with a narrow top. This means that there is a lower mean of life expectancy. The second type is constrictive population pyramid. It's a pyramid of developed countries and characterized by narrow base, which means low birth rate. It tapers gradually due to lower age-specific death rate. The pyramid is high, which means longer life expectancy. Stationary population pyramid is characterized by moderate birth rate, low death rate, triangle shape, and the growth of the population is slow or stationary. Declining pyramid or population decline pyramid characterized by low birth rate and moderate death rate. It has a diamond shaped, so the rate of natural increase become negative and population begin to decline.